So again, just want to welcome you that you have found the Q&A session for Building the Team, Prevention System Governance and Collaboration. This is a follow-up to the main conversation on the same topic that happened on July 20th. The link that I previously dropped into the chat will take you to that so you can watch the recording, which I'm guessing you saw, if that's what you're doing here. And before we get started, I want to introduce you to our moderator who's going to kick us off and get us right into the questions, the important questions you came here for. That would be Dr. Kuj Cooper, President and CEO of Implematics.
Thank you, Jessica. Good morning, everyone. Thanks for joining us today. As Jessica mentioned, I will be your moderator today. And with me are our experts that were with us for the Building the Team Learning Forum. Richard Connect, who is a managing partner at a consulting firm called Integrated Human Services and has been working with CDSS on special projects. David Swanson-Hollinger, Senior Program Manager at the Ventura Human Service Agencies in the child welfare area. Salita Dabrowski, who works in the public health area of Ventura County and is also the board president of the Child Abuse Prevention Council, and working with Salita, shoulder to shoulder, Jackie Flores Ortega, who is an outreach specialist and a parent partner as part of the Partnership for Safe Families with Child Abuse Prevention Council. Cheryl Fox, who works at Ventura County Behavioral Health as the Youth and Family Division Chief. And finally, Jack Trope, who's the Senior Director of the Indian Child Welfare Program at Casey Family Programs. I also want to make a pitch for our learning series that is coming up on August 17th. It's called Designing a Comprehensive County Prevention System. And you know, this is not me, my comment following is not meant to raise any anxiety for folks, but the work that's reflected in this learning series is likely the biggest lift with regard to readiness and getting your comprehensive prevention plan done. This is where we'll talk to you about what analyses you're going to need to do with regard to estimating how many children and families you might serve, how you might go about assessing your service array, how you might go about doing gap analyses, how you might go about funding this system that you've created. And these analyses are probably going to be the centerpiece of your comprehensive prevention plan due in January. So I just want to encourage everyone to sign up and go tell folks who are going to do these kinds of things, analyses, service array inventories, fund cost planning, spending planning for these services. I would encourage you to invite them to our session on 8/17. And then, as is our custom, 2 weeks later, we will have a Q&A session that reflects questions that arose before, during, and after that learning series. All right. So here is our plan for today. It is very similar to our Q&A session format from our Q&A session last time on building on our fiscal and funding. So from 9:10 to 9:45 approximately, there are actually questions that we gleaned from the 720 Learning Forum and from an inquiry we sent out after to those that participated. We will hopefully have 10 minutes or so, and if we get done the prior questions, we'll just go straight into an open question session for folks from the audience. About 9:55, we'll go into those breakout groups that Jessica mentioned with sort of a more personal small group office hour with our experts. We'll be having folks talk with Richard Connect about AB 2083, interagency governance. The Ventura team will be in their own breakout room talking about their collaborative framework and answering questions about, you know, how they applied all this theoretical, what you should do, to actually doing it on the ground. And then we will have one breakout room for questions about tribal engagement and some small rural county considerations, because, you know, particularly those in small counties listening, you know, that you know, often we see large county examples and those don't necessarily apply to smaller or rural counties. So we'll spend some concentrated time talking about that. You will be able to move between the breakout rooms. So if you come to one, get your question answered, and decide you want to hop over to another one and ask a question of another expert, you are completely free to do that. The questions that our panel will answer today came from the Learning Forum Q&A. And we plan to have, we're catching up with ourselves, but we plan to have written responses for all questions, even the questions we don't have time to answer today. Responses from the Fiscal Learning Forum and Q&A will be posted on August 17th. And then responses for this Q&A session, Building the Team, will be added by August 19th. Let me see if there's anything else I want you to know. Okay. Oh, no, sorry, that's not what I meant to do. All right, so I'm going to stop sharing screen here so we can see each other, and I am going to get straight into questions. And then I have a resounding vote of confidence from someone's pet in order to do that. All right. Okay, so the first question today I'm going to ask of our partners at the California Department of Social Services. We have Hillary Conrad, who's the Chief of the Office of Child Abuse Prevention. And we have Kelly Winston with us, who is the Bureau Chief of the Child Welfare Policy Unit. I probably don't have the entire name of that unit correct, and Kelly will likely remind us what that is. But here's the question for you, Kelly and or Hillary. Is there a plan for more state guidance to be provided around the assessment for candidacy determination, or should counties decide what assessment to use?
Good morning. Thank you, Kush. I'll take that question. So I'm Kelly Winston. I'm Chief of the Family Centered Safety and Support Bureau at CDFS. And, happy to talk with folks about the concept of candidacy. So in our last draft of the prevention plan, we really laid out examples of how candidacy could work. But when it comes down to the assessment of candidacy, it's a social worker's professional opinion about what the characteristics of risk are, and then their current instability or any safety threats that might further place that family at imminent risk. So really, when you think about it, it's those two factors: characteristics of the family that demonstrate risk, and then current instability. So those two things really are what we're looking at in terms of candidacy. The plan further gives you a number of populations that can demonstrate examples of what that could look like. Both the characteristics, there's a number of pools of folks that are that we think are likely to fit that bill if there's some instability in their family system at that point. And then we also have some examples of what that family instability would look like. So that's really how California is determining candidacy. When we have automation in place, there will be a method in our automation that will help folks document that information, but there's not going to be an additional tool or really any further guidance. What we would like to do is really help you think through what that looks like, right? So all of those examples that we gave may help you identify your demographics by helping you target the universe of potential candidates that could receive services. And we know that you need to do that in order to identify like how you're going to organize your comprehensive prevention plan. So we can help think through some of those things, but really it comes down to those two factors. What are the risk factors, and what are the current circumstances that describe instability that could lead to imminent risk? So really try to repeat that. Those demographics are really to help you determine your universe of potential candidates, but those two factors are just the key.
Thanks, Kelly. Next question, and I think Hillary, this one is targeted at you. Can the team speak more about the envisioned difference or intersections between a county's 5-year child abuse prevention plan and the CPP?
Hi, good morning. Thanks, Kush, for that question. And that's definitely a question that we've been hearing in the field about how does the California Child and Family Services review process, which includes how OCAP or how counties are going to spend their prevention funding and determine which prevention services they're going to provide. So if this question, when it says the 5-year child abuse prevention plan, is referencing that process, that process is very separate from the comprehensive prevention planning process. And with that California Child and Family Services review process and determining how to spend prevention funds and which prevention programs will be delivered, that is really focused on kids that are in care, even though there are prevention funds. And it's more deficit based and focused on outcome measures that are related to children that are in foster care. So we see that as a very deficit-based process and a very separate process. Now, on the other side, the comprehensive prevention planning process is meant to be more of a strategic planning process and thinking of all the levels of prevention, from our general population to kids that may have risk factors, and then to keeping children at home with their families and not even entering foster care. And with that process, we really want you to be thinking about building a child and family well-being network and all the different cross-sector collaborative partners that need to be involved in order to make that happen. So they are two separate processes. What I would say the intersection would be is that there's activities that happen during that county self-assessment process when they're determining how to spend their prevention funds that can be leveraged during comprehensive prevention planning. And in particular, that would be looking at your service array, looking at what populations are at greater risk for child maltreatment, thinking about what training is already being provided to your community-based organizations, as well as your child welfare staff. So there's definitely some intersections there. And what I would also mention is that we've decided it's really up to the counties, given that they each have unique circumstances operational wise, to make those decisions about what that looks like.
Thanks, Hillary. And so what I'm hearing is that while activities and analyses that were conducted during that self-assessment could be leveraged to complete the CPP, they are indeed different documents, but of course should reflect each other for a full continuum of support for children, families, and a county.
That's correct, and thanks for the clarification, Kush.
Yeah. So there's a couple of links that are being dropped that are relevant to the question and answers we're having right now. One is a registration link for a comprehensive prevention planning support orientation. Hillary, can you say a little bit about that?
So what we've been working through at the state is figuring out what support we're going to be providing comprehensive prevention planning teams, so our cross-sector collaborative folks. And we've decided on hosting an orientation to help all the teams to know what support exists, where it is, and who is going to be providing that support. So we recently came up with the registration link, and that's the link that just dropped. And we will be sending out a flyer, but it's currently in internal review.
Thank you, Hillary. And then just the other link that you probably already have, knowing the speed of the team, is the block, what we refer to as the block grant letter, ACL 2223, which reflects all the elements of the comprehensive prevention plan. And of course, one of the elements included in that is, well, what is your governance structure? Who is your oversight body? And that's relevant to the Learning Forum and today's Q&A. Okay. Thank you, Hillary and Kelly. We're going to move on. So is there an update on how soon and I'm going to add a slash there, the or a readiness assessment will be available? And I put that, I put the A in because there isn't necessarily one readiness assessment that can get you ready to provide comprehensive prevention services and to, of course, describe those in a plan. We are in partnership with Casey. Implematics is based on these readiness domains that are being unveiled through this learning series. We're creating an implementation guide, and there will be a tool so there'll be an implementation guide. There will be links to tools inside of that implementation guide to help you complete different parts of the CPP. This phase of the implementation guide, you could say the 2022, will be more focused on only the areas that you need to worry about to complete your CPP. Anything that's more, implementation related in terms of like, what's your business process for X, Y, or Z, those are all, we'll have a learning series and sort of a next phase of the implementation guide in 2023, but we know that everyone's focus is going to be, what do I need to do for the CPP? So that implementation guide and some of the tools associated with it, we plan to unveil on the Q&A session on August 31st, which is associated with the learning forum on August 17th, which is about designing your program. We will also have a checklist for those folks that like to use checklists that are associated with that guide. You could call that a readiness assessment, but I just want to emphasize that, people, you can, just because you complete a readiness assessment, then, and you full checklist says we did this, we didn't do that, doesn't necessarily get you ready, right? That illuminates things that then you have to go work on, and really we're anticipating that the guide will be all that you need. But we will have a checklist that's associated. So yeah, August 31 is it. So if you want to see it before everyone else, you likely want to come to that Q&A session. Okay. Next question, and this is for the Ventura team, and David, I'll punt it to you, and then you can sort of divvy the questions out with regard to who's most appropriate to answer them. Okay, so it's a pretty general question, but folks are wondering about sort of, where do I start? Like, here you go, we want to do prevention. We can see the science is telling us that we could really impact folks entering the system if we do, but where do we start?
Yeah, that is a big question, and I'm going to answer it in a general way and then let my colleagues talk about some specifics. And this is in the context of what we're trying to do in Ventura, which is to integrate our prevention work, and as I've said before, actually want to call that wellness system building work with our larger system of care work and our AB 2083 and cross system work that we're doing. But I think to start with, in our mind, there isn't really a step-by-step. I mean, this is adaptive change that we're trying to move forward. And so to a certain degree, we're figuring it out as we go. And I think I'll sort of hit on three quickly things that I think are key to start with. I had talked about this last time. It starts with relationships, just like we talk about with families, parallel process here. And it starts with those relationships with our partners across other systems, public and private, and building on those relationships. And the prior work we've done together, I think, has been really critical for us, whether it's with the Ffpsa or KDA work or continuum of care reform or wellness work in schools, MHSA. There's a lot of different places where you can start with this. Part of the work, a second point, is working together as you're building on those relationships. And this is an iterative process, it evolves, but building that inclusive vision and as a way to build the commitment among partners. So there's a reason why we're calling it a wellness system and not a child abuse prevention system or about the child welfare continuum, because we want it to be resonant with all of our partners. And then lastly, I mean, you just alluded to some of them. There's some really good tools out there that are coming online that I think can help to support the work. The integrated core practice model, all the work and all the tools that are here to support the comprehensive prevention planning, integration with the county self-assessment processes or the Mental Health Services Act processes, all of that, there are ways to integrate those into this process. I'm going to pass it to Salita to maybe give a little more specifics on what she sees here locally.
Thank you, David. Yes, good morning. So like David said, it really is just building relationships and starting with what you already have in place. One example, I think that was a great starting point for some of the work that we've done is our partnership between public health and child welfare and our Cpps. We actually utilize some of our child abuse prevention funding that we get from the state that funnels through our Cpps to develop a child abuse prevention program of public health nurses that worked in collaboration with our child welfare social workers for those families that are at risk of having their children removed. So it hadn't quite hit that point yet. And so I think that's where a lot of the relationships started, you know, on the public sector side, working with child welfare, public health, behavioral health, but also some of our private partners. And I think, you know, relationships grew from that type of programming. So I would, you know, definitely recommend to look at what existing programming you have and what relationships you have and start building from there, getting leaders in those agencies and organizations to start talking and brainstorming about how you can leverage existing programs and services and grow them from there. You know, I think that's been key. That's a lot of the work that I've done alongside, you know, David and child welfare and Cheryl and behavioral health for many, many years. So I will pass it off if Cheryl has anything to add or if Jackie has anything to add.
Hi, good morning. Yeah, as the question came up, I was thinking, looking for those places where there's already that intersectionality to connect regarding those shared youth. And that's been a really great opportunity across the board to really support youth and their families in Ventura County. So that's what I would just amplify. Thanks.
And I would just echo what Salita and David and even Cheryl said, is just it's the relationships. But what I will say is that I think one important part is just to include your parents in the process as well.
Thank you very much. And then I just point you to some links that are reflect what Ventura County has done. There's a vision brief that they have that we've uploaded for you. You know, Don Winstead told us a couple of forums ago, right? The funding is just the gas in the car. The vision is your GPS. It's where the car is going. And you know, when you're building your team for governance, well, what journey is it that they're governing, right? Well, they're going somewhere, right? And so this vision brief is a great articulation of where at least one county's shared governance is going. They've got also some an engagement tool that there's a link for their quilt that has been a community-based engagement tool to bring their folks with lived expertise, bring populations disproportionately represented, parents, youth, a friendly engagement tool rather than sort of these very corporate government documents like you know, MOUs and spread cost plans and things like that. And then speaking of MOUs, Ventura County's Child and Family Wellbeing System MOU with which reflects their 2083 work is also there for you. Okay, I am going to move on to some questions for Richard Connect. Good morning, Richard.
Good morning.
So first question, is it true that funds expended by other agencies, so for example, Office of Education or First Five, can count to the 50% match for, it's relevant to Title 4E drawdown, and how would these be reflected on a county expense claim then?
Yeah, really good question that requires both some adaptive and technical analysis, as David referenced a few minutes ago. So the short answer is yes. There are many sources of revenue allocations within your budgets, plural, because we have multiple departments doing planning, right? any, hypothetically, conceptually, any non-federal dollar, state dollar, local dollar, county general fund, private grant, any dollar that doesn't originate in Washington can be used as a match, certified public expenditure, to pull down a federal dollar. And remember, the complexity of this is difficult to manage, but the flexibility of it is fantastic. And remember that you have actually two federal sources. There are, if you start with a broad community-based prevention plan and multiple partners, you've got Medicaid dollars that are Medi-Cal in California, right? Those require a match. And then the federal 4E dollars that are diverted, waived, if you will, through Ffpsa, those also require a match. So you have two federal sources, both with this great flexibility. If you can figure out locally how to bring your partners into conversation to identify how to match, and you draw down these multiple revenue streams with great flexibility. The back half of this question, I don't have a satisfactory answer for you right now because it's highly technical. And the answer is it depends on how you leverage those dollars. So your expense claim is going to be very specific to who does what within the prevention, within the service model you select, and what their job class is, and where the revenue comes to match. So I'll leave that to your local folks to tell you. And this is why we emphasize a great deal about having a financial analysis party. You got to pull all your department's financial gurus into the same conversation in an ongoing way, so they can figure out how to leverage all these dollars and avoid an audit challenge. The state is working on some tools for payer of last resort. They'll be available hopefully this fall. And that might give you a little more answer on the technical aspect of expense claiming.
Thank you. Next question. Well, so and before we move on, David, is there sort of anything you have to add, given you've been at this for a while? I mean, some of this is, I know, even new to folks that have been doing prevention for a while. But, we've got some new legislation and some new requirements. But if you had anything to add here, you may not. But I'll just open it.
I mean, as Richard said, there's definitely the technical aspects, and I'm not a CFO, I'm not a fiscal expert per se. But I think the other part of it is even just getting ourselves to think differently about this. And we're excited that our interagency leadership team is starting to talk about this, and in a way of the concept of shared funding and shared resourcing, because it is a different way than many of us have operated historically. So I think that part of the adaptive is really critical, and understanding then how to apply that in a technical way, like Richard said, is very critical.
Thanks. All right, next question. Richard, clearly all the agencies named provide prevention services, the ones you named in your presentation, that could impact child welfare overall, but the services wouldn't necessarily be delivered to an Ffpsa eligible youth or family, right? How would that work?
Yeah, really love this question because it brings us back to comprehensiveness, right? So you've heard, if you were with us in any of the prior events, you've heard Kush and others talk about the interface between the CPP process and Ffpsa, right? And we've tried to encourage and continue to encourage to take that first broad umbrella of comprehensive prevention planning. And the state put out this beautiful letter on March 10th that you see linked in chat that really encourages us to come out of the silo of candidacy and Ffpsa into this broad neighborhood of prevention from various cohorts of departments and agencies, right? If you take that highest analysis first, then the answer to this question is it doesn't matter, right? Like you don't care. Like you're trying to get, as a collaborative, you're trying to get as many young people as possible into a prevention or early intervention service, funded by whatever partner in your comprehensive prevention plan is most accessible and available to that kid, right? So big answer, short, unsatisfactory, is it doesn't matter. Now, coming underneath that for candidacy, this is where you got to have that local conversation with your planning group around, after you do that analysis of the broad umbrella of our prevention services, and you figure out where these the kids are going to fit within that matrix, that continuum of prevention, then you have to figure out the candidacy piece underneath that. And again, that's a local adaptation you have to figure out after you've determined which evidence-based programs are we going to deliver and how we're going to fund them. And then you can answer the question about whether whether candidacy applies or not. And
Encouragement.
David or others from Ventura may have thoughts about that as well.
Maybe a really short, a specific example that we're actually right in the middle of right now. Cheryl and I have been spending a whole bunch of time together in the last several weeks, looking at some infrastructure money to build a child, youth, and family wellness center that's, officially, starting from the context of behavioral health, but we're partnering closely with Ffpsa and our Office of Education and to a certain degree probation on this. And it's exactly what the vision is. We're evolving. This is exactly what you're talking about, Richard. This is a place for families to come and get supports. It's also going to be integrated in the same building as a family justice center. Some of those families will potentially be Ffpsa Part 1 eligible. Some won't. Some are going to be able to not have services through Part 1, but potentially through Ffpsa's services. And so it's really an attempt to integrate these various systems for families that are coming in with complex challenges and issues going forward.
Beautiful. No wrong door and no eligibility, really, right? Like, it doesn't matter. We're preventing trauma by keeping kids in community through whatever resource we've got in our county. We're going to drop some tools into chat here for you. There are 4 or 5 resource documents that we think are just really fantastic. While we await additional guidance, I think, and technical tools, there are some great ones. I love this, the tool from the Crash Foundation that really talks about how to do good collaborative planning. And so just draw down these out of chat. They might stimulate your thinking locally about how to get in the sandbox together.
And there's a few more. There's financing new approaches to achieve child well-being from the California Children's Trust. You've got some fiscal mapping for early childhood services. The early childhood education field has been doing prevention, since its inception. In some ways, that's why it was born. It's probably a great place to look. There's a tool from school-based mental health services, right? So how to think about using what's happening in schools with children and families, using other funding streams, how to look there to start thinking about what you might want to do. And then there's a fact sheet for Medi-Cal and behavioral health services, and sort of how you could bring that thinking to funding portions of your continuum. Thank you. So next question for the Ventura team. What are options for counties that are having significant staffing concerns? And I'm not sure I know any counties that aren't at the moment. So it's pretty broadly applicable. So who in Ventura would like to start speaking to that one?
I think I was going to speak to that.
Perfect. Thank you, Cheryl.
The context is I'm a fairly new division chief for youth and family, and kind of came on into that position, though I've been here for 25 years now, with that staffing crisis. And I think it really has come down to those relationships and that transparency, and looking at ways to leverage the staffing that we do have across agencies, and really brainstorming and strategizing with what we have, and brainstorming next steps, plans. I think I shared this before, but we did a hiring fair because I was like, we just have to move this a lot quicker than county time. How are we going to do that? And in one day, we made 28 offers, and it took, the bulk of our leadership team to really be there and commit to a full Saturday and all the prep. But we had 28 offers at the end of that day. So again, looking at what you do have and building on that where you can. And I know that there's not any easy magic answers right now. We're looking at building workforces and, internships and all of that. So kind of leave no stone unturned. Thank you.
And it strikes me, Cheryl and others that, especially, I work a lot with the child welfare systems in counties, and, everybody has been really struggling to fill positions. I am also a professor of students who are about to go into the child welfare field. So I sort of hear that side of it too. And there's something about prevention and working on prevention that fosters hope and excites our incoming workforce, right, about what the difference they might be able to make, especially given what you're hearing in the news these days about family policing. And so that's just one thing I'd add, is that really, like, working on prevention should be a selling point, right, for when you're recruiting folks. And then the other related matter is, with these, let attrition work in your favor in some ways. So if you've got empty positions sitting on one side of the continuum, you may want to move them to another part of the continuum, because you don't lay anybody off. You don't have to tell anybody their duties are changing. You reclassify. Now, that's it's overly simplified to make a point. I know that there are lots of devils and lots of county HR details, but it's something to think about. Is, let's make lemonade here with some of these workforce shortage lemons that we've been given. Right, and this is where having HR at the table might be helpful, in addition to your fiscal folks.
Kush, I would just add to that a little bit as well. I think that the other thing that's really important with staffing concerns is retention, and looking at how are you keeping the folks you have. We struggle, just like everybody else in public, especially public health right now, at keeping people. People are tired and burned out and stressed. But looking at how are you retaining your staff? How are you supporting the ones that are staying? And really, building a system of support around them to do this difficult work, through things like maybe a mentorship program. Are you pairing newer staff with seasoned staff, and it helps both. It helps the seasoned staff to kind of be refreshed, and it helps the newer staff to gain that wisdom from others. So I think looking at mentorship programs, looking at how are you retaining your staff? How are you supporting them? How are you really providing them with what they need to be successful, to stay on long term and not burn out. So I think that's the other piece of it. Yes, getting good people is always going to be a challenge, but how are you keeping the good ones you have? It's a challenge. I don't have a magic bullet answer to that. It's just, I think mentorship programs and, just really good staff support is helpful.
It's just such a great point, Selena. And I want to underline a word that Selena used, which is the word program. When she said mentorship program, right? Having a barbecue every now and then doesn't a retention program make, right? It's got to be a documented recognition, reward, and retention program, but there are clearly things to gain from having one, right? But I do see that often in some of my organizational transformation work, as people go, well, yeah, we do every now and then, we hand out gift cards or we do this. It's like, is it part of an overarching retention program? Really great point, Salita. Thank you.
Hey, Kush, can I jump in here real quick?
Absolutely.
Hey, it's interesting because I met with 2 of my counties on our prevention planning this week, and we're talking about the recruitment of lived expertise to the table. And just want to highlight the concept that this is a parallel process. If we're going to be doing it, with ourselves in recruiting and talking about Salita, I agree 100% with retention. We're also going to be developing a similar model, which I've been working with a lot of the counties to bring in our lived expertise and also retain them, so the parallel process can be highlighted.
Yeah, great. Thank you, Troy, very much. Okay, let's move on to some more questions. Richard, I'm going to throw this one your way. How to proceed if probation and child welfare have different ideas, which does happen from time to time.
Yeah, and isn't that great, right? Like, embrace the differences, because it's from those differences that the innovation will emerge, right? So if you're not aligned, fantastic, celebrate it, and then bring people into interagency leadership conversation, right? So think back 2 weeks, we talked about the ILT being the the ideal bucket into which to have these conversations, bring those conversations into that agenda, work out the alignment about who and how to serve, and you'll get to the finish line through ILT.
Thank you. All right, I am going to get Jack Trope's voice in the room here. Jack, the question coming at you. Can you clarify how tribes access 4E funding and the connection to the state 4E or 4E agency's responsibility to create agreements? What are county obligations? And I suspect that it's a two-part answer. You know, there are the 4E tribes and then there are the non-4E tribes, but I'll let you expound on that.
Okay, well, interesting question. Some of it's pretty straightforward, some of it isn't. So how do tribes access 4E? There are basically two ways the tribes access 4E. One is if they have been approved for direct 4E funding from the federal government, and you have one tribe in California that has been the Tawa Dene, I think it's Dene, I think that's how I say it, Nation. And then they can also access it through tribal state agreements. And you have two tribes that have tribal state agreements. The Yurok and the Karuk tribes have tribal state agreements. I understand that those are partially implemented. They're not fully implemented, but they are partially implemented agreements. And so those are the two ways that the tribes generally access 4E directly. Now, there is some conversation that's going on. I know the state of Oregon is involved in it about whether or not tribes could execute family first only agreements with the state, since the language in the statute says that the state must negotiate in good faith with the tribe concerning all or any part of the 4E program. And so Oregon was looking at that and saying, well, you know, family first is part of the 4E program, and so why can't we just contract for that? Thus far, the Children's Bureau has not agreed with that, but there are the process is still going forward, so we will see ultimately whether that's something that's possible or not. Now how the counties fit into all of this, that's sort of the greater part of all of this. You know, in other states with county-based systems, I mean, my understanding of the agreements that the two tribes have with the state now is that they kind of operate similar to counties in the sense that they do all the work internally, they do the eligibility determinations, all of that, and then submit everything to the state in the same way a county would. That's what I believe, how I believe it works. If somebody knows differently, please correct me, because I'm sort of getting that secondhand. But in other states where there are county-based systems, in some of those states, you might even have the tribe working directly with, even though the agreement is with the state, you may have the tribe working directly with the county on things like eligibility determinations, for example. So there are a variety of different ways that this happens. Now, in terms of the relationship between the county and the tribe, certainly there is there are agreements that don't necessarily tie directly into 4E reimbursements. You know, a tribe can provide services through other funding that may be made available through some kind of an agreement. Presumably, if you had an agreement with a tribe in a similar way that you would be able to claim 4E funds for a contract you might have with a provider, if the tribe is providing a service through a government-to-government agreement, it wouldn't be the tribe directly necessarily submitting for 4E funds. It would be presumably the county, but that would be another way that assuming that the tribe is interested in doing this, to provide services to their families that are in the counties, say in the custody of the county, for example. That might be another way that indirectly would provide 4E access. But there really is not a legal obligation on the part of the county under federal law to negotiate an agreement. That's really a state level legal obligation. It would make sense for the county to be engaged in that discussion, perhaps. That could be useful depending on the details. And the only other thing I would say is that well, no, I think I'll leave it there. So I hope that answers the question. I think that oh, I know what I was going to say. That I know your state statutes have laid out certain obligations for counties in this process, right? And I kind of would defer to those you locally who are more familiar with some of those provisions. But I know that the tribes are specifically mentioned in some of the state statutes that sort of have given rise to this process. So that would be something you need to look at as well.
So looking at the time, and I'm going to sort of open it up. If we have questions from the floor, I'm going to answer some of those, and then should there be more time, I'll come back to some of the prior collected questions, and the ones we didn't get to in open forum from our prior collected questions, we'll bring those into our breakout groups as well. So first question from the floor, so to speak, from the chat. Do out-of-home voluntary services qualify for Ffpsa? And so given there's an A, I'm presuming that's speaking to 4E funding. I'm wondering, CDSS? Yeah, Kelly was going to throw that your way.
Yeah, so the requirement for eligibility for 4E programming is whether or not it's considered foster care. So if the voluntary placement is a formal placement agreement, that is unfortunately considered foster care. But if it's some other informal arrangement where for some reason the child just isn't living with the parent, that could still potentially qualify. The thing to be paying attention to is really whether or not there's a placement happening, and that placement is a foster care placement.
Thank you, Kelly. And I'll stick with you for this one also. Regarding the CPP, is it correct to say, and Hillary, you may have something to say about this also, is it correct to say that the CPP should build upon the broad prevention planning that counties did through OCAP-sponsored planning efforts, but that it should also contain the required components of the CPP that are more focused on Ffpsa, perhaps as they relate to some of the strategies? So that's the first question, and it really is at the nexus of both of your work together. And then the second part of that question is, will more guidance or structure for the plan itself be provided?
So I can answer that. So we know that counties have been working really hard on their prevention programs, and we want to give you opportunity to leverage the activities that you've already done. Absolutely, we know that you're potentially ahead of the game when it comes to building those upstream programs. So definitely use that. But we also want to see you take advantage of the Title 4E programming. So as long as you meet the requirements of the CPP, if it really looks more like your original plan, that's fine. And I don't know that we have any additional guidance coming on what the plan necessarily requires. I mean, that could happen, but right now there's nothing specific in the works. And I guess it really depends on what you need, right? If there's something that you think that we haven't answered yet, that would be good to hear. If we feel like there's something that is still a need, absolutely, we want to respond to it. Hillary, do you have anything to add?
I would just add, you might be hearing a theme here that to leverage what you've already completed when it comes to prevention, leverage those cross-sector collaborative groups that you've started to form, and then figure out how you can also meet the required components that are in the CPP. So specifically, leverage those county self-assessment processes, leverage your AB 2083 teams, and then leverage if you've been working on the voluntary unfunded prevention planning effort that's been happening since 2019.
It's Richard.
And that's just from my perspective. There could be other activities from other service sectors that could be leveraged as well. And I think Richard.
Yeah.
So Hillary, perfect tee-ups. So yes, start with that collaborative work that you've been doing under OCAP, and of course connect that to your CPP plan. But remember that this is bigger and deeper, right? If you go to the MHSA partners, if you go to your school prevention partners for multi-tiered systems and all that social emotional learning, that tier 1 stuff that schools are doing, probation grants, the JAG grants, your juvenile justice crime prevention. I mean, it's endless in California. So leverage is not just the OCAP to CPP. It's that historic thread, but going outward and deeper in all those directions, right?
Thank you so much. Okay, we have another question. And Jack, I'm going to send this to you. Can a tribe provide programming as part of community pathway funded, through a community pathway that's funded via Ffpsa, even if they don't have a 501c3?
A tribe would never be considered a 501c3 organization because it's a governmental entity. It's not a nonprofit organization. So the tribe would be providing those services as part of its governmental function. Now, could a tribe charter a nonprofit under its own tribal code? It could. And under the federal IRS code, there is a specific provision for tribal nonprofits. It's not actually 501c3, it's another section, and that section escapes me. So a tribe could create, could charter a nonprofit, or if they wanted to, but they wouldn't have to provide those services because they're providing it as a government entity. I mean, keep in mind that people have tri-citizenship. Essentially, they are citizens of the United States, citizens of the state of California, and citizens of their own tribes. And so, this would be something that a tribe could provide to its own citizens through an agreement. And in fact, could even provide it, I'd say, beyond its own citizens. Most tribal programs, say health programs, for example, I mean, they're probably servicing anybody who is a member of a tribe, not just their own citizens, if they are within their geographic service area. So, they would not come in as a 501c3 unless they chose to charter something like that. They would come in as a governmental entity.
Thank you, Jack. Hey, next question. What about kinship placements where there are payments to family? How can that family access prevention services without losing their other critical payments? Let's see. Kelly, do you have a sense of this?
So again, what we've really been focused on is that concept of, is there a foster care placement? And so I'll be honest, I'm not quite sure whether, like, if a family is getting a kin gap payment, whether that might be a factor. So that's something I will definitely take back, and we'll give a response either for you all in the next Q&A or through an FAQ.
Great. Yeah, it's a greght question. It has sort of maintenance of effort implications, etc. Yeah, great question. Thank you for that one. And it sounds like we will definitely be researching a written response, and then we'll get it back to you in the questions. Okay, we have another question. Do you, and I'm gonna send this to Ventura first. Do you have suggestions for how Cbos can collaborate with counties on developing CPPs?
I was going to actually respond to this person in the chat, but I would highly recommend reaching out to your Cpps, your Child Abuse Prevention Council, because they should have a direct link to the county and partnering with them, on these prevention efforts. And so that might be a way to get involved in some of this work, is if you reach out to your local Cpps, because it sounds like you've reached out to some of your county partners already, maybe not really getting a response. And so maybe kind of going around the county and coming in the backside might be a good option. I don't know if David, being from child welfare, has a different suggestion, but just knowing how our county works, I think that would be a great way for you to get in touch with your county.
I was going to give a similar response. I know we're hoping to leverage the partnership that our Cpps already has with community providers in this work going forward. So no, I love that answer.
Yeah.
Ush, can I offer a couple thoughts?
Absolutely. Richard, you read my mind. I was going to see if you had anything to add to that.
So I spent a few years in the CBO world running programs, and then in the county land. So two thoughts. One, remember as a CBO that depending upon the county's approach, there may be parts of this planning process that you can't be privy to, right? Like if they get into contract conversations and that kind of work, they're going to excuse you because they have to, right? However, here's the strategy, and I'm going to risk ticking off my former friends in county land, but what always got my attention as a county executive is when I got a lovely email or a phone message from a CBO partner that said, hey, I've been trying to engage on this, haven't had any luck. And I think at this point, probably at the next Board of Supervisors meeting under public comment, I'm going to approach your board and your county executive about my interest in being a part of this conversation. If I got that kind of a message, I would be all over a response, right? Making sure that my folks got to the partner and said, hey, how can we help you, right? Forgive me, county folks.
You know, I think you're forgiven, Richard. You're getting smiles. The other thing that strikes me here is folks are wondering. I hear folks asking a lot, like, oh, have I missed it? Like, what happened? Nobody, you haven't, right? Folks are still working on how to tweak existing structures, governance structures to what needs to happen, getting their arms around what's going to go into a CPP and how to leverage things. So I can't think of a county that's so far ahead that you've missed it. So, you know, these strategies that our experts are sharing with you, you know, you can use them now.